Hi, I am Dr. Felice Gersh. Welcome to my Instagram live show on living in the era of coronavirus. I want to introduce myself to those of you who do not know me. I am an integrative physician specializing in all aspects of female care. Also, I do see men. It's really important now during this really novel time with this novel coronavirus for us to take stock of every member of our family to see how he or she is doing. I've talked about reproductive aged women, menopausal women, the elderly. Well, what about the young teens? What's happening with them during this time of a pandemic when they've been told to stay out of harm's way in their home, when that's the last thing they want to do? They want to be out with their friends, they want to have adventures, they're not able to go to school. What about having peer relations? What about dating? What about having fun? This is not what teenagers signed up for, and of course they're going to have difficulty. So let's see what we can talk about to help them. Well, I focus a lot on young teenage females, so I'm going to start with them. Now, here they are at home when they're probably dreaming romantic thoughts and they want to go out with their friends. They want to get their hair and nails done. They're thinking about dating, and here they are sitting at home watching Netflix, maybe spending hours on FaceTime, but it's not the same. So what can you do? Well, first of all, as you know, a lot of the distancing and sheltering at home kind of requirements are being lifted. Well, we have to be careful because, as been stated many, many times, the virus hasn't gone away. We just don't want to live this way anymore. And that's really kind of the sum of it, is that people just can't go on being in a social isolation type of a state. And certainly teens can't do that. But we don't want to let down our guard. Now, here's the good news. There are virtually no deaths in teenagers. They're actually the safe group. They have excellent outcomes if they get infected with this coronavirus. But here's the problem. They're not living in isolation in terms of their family. Most of them will have elderly grandparents that they'd like to see. And of course, the grandparents really want to see them. And their parents may be older and may have some pre-existing medical conditions like diabetes, heart disease, hypertension, and so forth. So that's sort of where the concern is. Not so much for the outcome if a teenager gets infected, but what happens when they are infectious and pass the infection on to a dear family member or other individual in the community. So that's why we really want to watch out for that type of thing. So we can have teens go out now, though. They don't have to stay home, but they have to do social distancing. They have to be aware that many teenagers are probably the ones who are out there asymptomatic but very infectious. And so we have to be careful, because if they get infected, because we have lack of testing, we will not know that until perhaps in hindsight we find that an ill elderly family member is suffering from an infection with the coronavirus. And as you know, we still don't have a cure. We don't even have really any wonderful approved treatment. Remdesivir, I don't know, it doesn't seem that great to me. It shortened a few days in the hospital, did not actually meet statistical significance for saving lives. There's a ton of research going on right now, and I am so optimistic that better things are coming down the pipeline. But for the moment, if someone who is at high risk becomes really ill, we don't really have great treatment. They're looking at giving TPA, things to try to reduce blood clotting and so forth, because of the occasions of having massive blood clots throughout the body and stroke. So we can't let up our guard, even though the teens are not really the vulnerable ones. The teens will be fine. So just tell your teenagers that they have to still be careful. They should not congregate and act like nothing's happening. And we've all seen that, right? Have you seen the beaches in Orange County? All those beautiful young teens having fun in their bathing suits and frolicking in the water like it's a nice day in the summer. But it's different now. So we still can not let our guard down. So what can teens do now? They can get together. They can take walks. They can be distanced. So you can be in the same general location, preferably outside since the weather is nice, and maybe they could, sit but stay several feet apart and, wear a mask, please, to protect everyone else. So, but it's really time to let teens have some kind of connection with other teens. But if they're not responsible, then it's not going to help. Just all those weeks that we were hiding out in our homes will be for naught, because we're just going to have flares. We're going to have hot spots showing up all over the country if we don't watch the teens. But we can't just hold them in the house as a hostage anymore. But talk to your teen. Tell your teen that it's so important for the safety of others that they need to try to not get infected, okay? And now what happens if they do get infected? Well, I would like that person to go into as much isolation in the home, and then the other family members who've come in contact, see if you can get some testing available. And also, remember the conventional medical approach. If you get infected or you think you've been exposed, do nothing. Just stay isolated, stay separated, but they don't have any medical approach to that. We don't do that in functional medicine. We look at the soil of the body, and will it nurture or will it be able to withstand an infection? So what we want to do is, if someone gets exposed, if someone has early signs, then you should talk to your doctor, your functional medicine doctor, or you can go to my website, or you can contact me, because there are things that you can do to improve your overall health, even at the last minute, even if you get infected, to help reduce some of the complications. Now, are there studies? Can I prove this? I can't prove anything because we have no studies, but we sure do have science. We know that a body that is replete with nutrients, has antioxidants, is fit, is well rested, that has proper hormonal balance, that body is going to do well. Now, let's talk about hormones. What about birth control pills? Many young teens are on birth control pills for a whole array of reasons, many of which have nothing to do with birth control. So what does that mean? Do we have any data? Well, once again, we have no data, but we do have science. We know that being on birth control pills alters the gut microbiome, which, by the way, so does menopause, and so does the coronavirus. There's actually published data that infected people with the coronavirus have an altered gut microbiome in a negative way. They have higher levels of Prevotella, which also menopausal women do, and this actually increases leaky gut, which can lead to the production of inflammatory cytokines in higher amounts, because you have these endotoxins produced in the gut going out and then reacting with the immune cells lining the gut, which will then create this inflammatory response. So young women on birth control pills actually can have a similar type of event. Now, fortunately, there hasn't been any data showing that women on birth control pills at any age have a higher risk. So that is very encouraging. But maybe they'll be sicker. I mean, we don't know. Why would we take a chance? If the birth control pills are not absolutely necessary as a contraception, but it's being used to regulate the menstrual cycles or for acne, there are many more natural and healthier ways to deal with those problems. And this is what, of course, one of the big focuses of my career is that I help young women to improve their menstrual cycles. The menstrual cycle is a vital sign of the health status of that young woman. If a young woman has terrible menstrual cramps, irregular cycles, very heavy bleeding, PMS, that is a sign that there's some underlying problem going on in her body, which is not going to be addressed by birth control pills. It's like taking a moldy wall and covering it with wallpaper. You're not remediating the mold, but you don't have to look at it. So we want to try to really heal. When there's inflammation on the skin like acne, that's a sign that there's usually nutrient deficiencies and inflammation going on in the gut. And we can give different nutritional supplements and work on lifestyle. Dietary changes can be amazing. Timing and what you eat, both in terms of reducing inflammation on the skin. And then, of course, there are some topical products as well. But we can do wonders with the skin, with having irregular cycles and cramps. Did you know that just giving your teen magnesium can tremendously reduce menstrual cramps for many young women? And then we have some polyphenols like pycnogenol and herbals like cramp bark. We have a whole array of different types of herbals. One that's called chaste berry, often known as the woman's herb, can help with breast tenderness, PMS, and irregular cycles. So there's a whole host. Taking some antioxidants, eating a diet high in vegetables, avoiding processed foods and chemicals can work wonders for your young teen's menstrual cycle. And it's not just about the period. Remember, the period is a marker for what's going on in the body. You want your young teen to have a healthy body, and fertility, which is manifested by a regular menstrual cycle, is a vital sign of female health. So this is a time to really think about the health of your teen. And what is she doing to be healthy? Is she sitting a lot? Is she out there exercising? What's her mental health like? Is she depressed? Is she anxious? We know that birth control pills, and there was just another study published this week that using birth control pills in young women increases significantly the chance of depression, because you don't have the right rhythms, you don't have the right hormones, and these are critical for brain function, brain health. And we're not even getting into what about the bones, what about the ligaments, and so forth. So if possible, let's look for natural ways to heal the body when the menstrual cycle is not right. Now, what about birth control though? Well, condoms are essential, and we don't know if coronavirus, if COVID-19 is actually potentially a sexually transmitted disease. Data just published showed that they have isolated this virus in male semen. They have not proved that it's infectious, but they have found it in several different males who were both infectious at the time, like in the middle of an active infection, they were suffering from symptoms, and also in the post-infection state. They also still found that there was viral particles present in the male semen. So of course, we don't know, it hasn't been proven one way or the other, but what we say, right, out of an abundance of caution, even if it weren't true that it's infectious that way, we would want to use condoms. But even if it weren't, my goodness, we know so many other things are infectious through sexual contact, like chlamydia and gonorrhea and syphilis and HIV. And then of course there's herpes and HPV. So all of them can be reduced. Remember, it's improving the risk. It's not eliminating the risk, but all can be safer in terms of potential catching of these infections if you use condoms. So that is, to me, required. No options, no excuses. Condoms for teens, actually for anybody, but certainly teenagers who are sexually active should absolutely be using condoms. And you need to talk to your teen. I hope you don't feel embarrassed about talking about sexual activity. Every creature on this planet is sexual, otherwise we wouldn't have new creatures. So it's no different than eating, breathing, going to the bathroom. It's another human function, and we need to talk about it. So talk to your teen about what options are out there. Tell your teen you want to know if she or he is sexually active. You are not going to do judgment. You just want to make sure that health is maintained. Health means emotional and physical, because we know hearts are broken very easily at any age, and especially in teens. And we know that there's so much bullying out there, and online bullying, in-person bullying, and teen suicides are not unheard of by a long shot. So please keep open dialogue with your teen. Know what he or she is thinking. Know what he or she is feeling, because only then can you actually be there to make a difference in the life of your teen. We know that a lot of teens go in their room and just shut the door, and you have no clue what's going on in that room. Try to create a dialogue and try to keep your teen not isolated in that room. You don't know what's going on, and it may not be healthy. Also, talk to your teen about drug use. I talk about this a lot, that marijuana is legal and it is really not good for young people. The brain is still developing up until about the age of 26. There's actually data that there can be habituation. It's not the same as addiction, but it's hard to stop using it when people are using it on a frequent basis. It alters hormone production. In young males, their testosterone, so important, their testosterone level will be lower. In females, it can interrupt the normal, beautiful rhythm of hormone production and create irregular cycles. So my goodness, if your teen has irregular cycles and she is using a lot of marijuana, whether it's edible or whether it's smoking or some other form, my goodness, and she has irregular cycles, the treatment isn't to go on birth control pills. It's to stop using the marijuana. It does affect the brain, especially the THC. So please talk to your teen. The fact that it's legal, and of course they're a teenager, they're not supposed to be using it, and I think you have to be at least 18, which is still a teen, but you really want to discourage as best you can the use of marijuana in any form in teens, because it really does affect their brain. It does affect their hormone production. The fact that it's natural doesn't mean that it should be used recreationally. I am in favor of the medical controlled use of marijuana and all forms of cannabis, especially hemp. I use a lot in my practice, but I'm very conservative when it comes to using it with reproductive aged women and men, because it really, especially the ones under 26, because it may have impact on their brains, which may be permanent, and it can affect the production of vital hormones that are needed not just for reproductive functions, but for total body health. So, and who knows what your teen is doing if they're in their room. Well, of course, some things you cannot smell, right, if it's an edible. So see what's going on if you can. And of course, if they're using other drugs, whether it's methamphetamines or even, worse, if they use ecstasy, please talk to them. There's a lot of teen use of drugs, and this can be very harmful. So see what their problems are. If you can't do it, get a professional. Even at this time, you can do things in person, but telemedicine with a therapist is very readily available. And a lot of teens, they really need it. They need someone to talk to. But like I said, they need their friends. We cannot isolate them from their friends. They're not going to develop properly, but they have to use caution. Please tell them that it matters for the population as a whole. Once we get a really great treatment, or we have a vaccine that works, then I don't mind. Teens can do whatever they want. But until that point, and I'm hoping it's going to be fairly soon, that the teens need to be told to do social distancing even when they're out together. So please tell them to do that. It's, if you have elderly parents, how are they going to be around the family? So this is important. Emotional contact, relationships are key to being healthy. Mental health, physical health. Remember, they're all one. And encourage your teen to get a lot of exercise. There's so much disappointment. Teens that are really active in sports, they were on their team, they were on the varsity team, maybe they were on club teams, and it's all folded for the moment. Have them practice on their own, because this is coming back. We're not going to live without organized sports forever. So if your teen has dreams of getting a scholarship to college on a sporting team, or they're even looking to go to the Olympics, don't let them lose that dream. Don't let them lose their hope. Help them to keep practicing and keep up their skills. I think by this summer, a lot of those team sports are going to start up again. I hope so. I hope that the young teens can do it, and I hope we'll have some kind of treatment for the coronavirus so that if they do get infected, if they bring it home, the elderly will not be at such grave risk as many of them are right now. So teens, it's time for them to get out, but continue social distancing. For young women, look at their menstrual cycle as a vital sign of their health. Don't cover up problems with birth control pills. Get to the root cause. For birth control, whether they do stay on birth control pills, because it's just what they're going to do, please include condoms. Maybe the coronavirus is sexually transmitted, but even if not, plenty of other stuff is. We don't want to let down our guard in terms of doing all the right things to maintain optimal health, even for our teens. They are a very high need group. They're often neglected because they don't complain about their health. But I'm telling you, They have a lot of issues, emotional issues and physical issues, and these are setting the stage for what their health will be like for the rest of their lives. So thank you so much for joining me to discuss this really important topic of teen health, teen life during this era of the coronavirus. And let me take a look at what questions have come in. Well, here's one that is very important. Self-esteem. Self-esteem is so important for everyone, and especially for teens who are trying to get a sense of themselves. Their self-identity is growing. That's actually connected to what I was just talking about, that if they're involved in sports, they cannot give up on their dreams. They may have other dreams. Maybe they're into singing, acting, they're performers, and now they're told the stage is closed. You know, the lights are dark. There are no performances. There's nothing. There's no activities along the lines of things they've been working towards. I really believe in my heart that these are going to come back. We can't live without art. We can't live without each other. We love sports. So find something that your teen is loving. And if they've been doing something, don't let them give up on their dreams. If they love to sing, have them still sing, even if the chorus isn't getting together. If they love to act, have them do some monologues. Have them do some stand-up comedy in the house. Have them do something to use their talents, and don't let them lose their dreams. Tell them all the time how valuable they are, how much you love them. Teens are so sensitive to criticism. Be careful what you say, because they will internalize it, and who knows where that goes. So keep the dreams alive for your teens. Compliment them, support them, and they will grow into wonderful, successful adults. So thanks again. I look forward to seeing you soon. Stay well, stay healthy. Use your good judgment in how you behave out there. Stay in tune with all the beautiful beat of life. I look forward to seeing you, and have a great day.